I'm Dr. K. Sita.
I'm Dr. Ajay from District Hospital, Vijayapura. I'm Ajay, myself Dr. Ajay from District Hospital, Vijayapura.
I'm Dr. K. Sita.
Would you mind saying your family or second year to the first year?
I'm Dr. Shravani, first year from Navodaya Medical College, Raichur.
I'm Dr. Sushma, first year from Navodaya Medical College.
I'm Dr. Pavan from Gadag Institute of Medical Science, Gadag, third year PG.
Guys, you are not supposed to start. Apurva, you are not supposed to start.
I'm Rahul.
Put the paper down. Volunteers, keep them upside down.
I'm Rahul from James Gadag, third year PG.
Upside down. Sorry, I missed that. Can you come again?
I'm Rahul from James Gadag, third year PG.
Myself, Dr. Nilkan, second year PG, James Gulbarga.
I am Dr. Lakhan, second year PG, James Gulbarga.
Myself, Dr. Sodhar Nayak, second year DNB PG, District Hospital, Ballari.
Ballari. I am Dr. Manaswini, I am second year DCH in District Hospital, Ballari.
I am Chandrasekhar, second year PG, RIMS Raichur.
I am Ankita, second year PG, RIMS Raichur.
I'm Dr. Faraz, I'm from WIMS Ballari, second year resident.
I'm Dr. Shri, second year PG resident from WIMS Ballari.
I'm Dr. Lahiri, third year PG from Alamin, Vijayapura.
I'm Dr. Asra from Alamin, third year PG. I'm Navya, second year KBN TGH Gulbarga. I'm Navya, second year PG KBN TGH Gulbarga. KBN sir.
Sir, Dr. Sneha, KBN TJ, third year PG.
Dr. Sai Gayatri, second year resident from JNMC Belgaum.
This is Likita, second year from JNMC Belgavi.
Good morning, myself Pranali, second year resident from MRMC Gulbarga.
I'm Dr. Pooja, second year PG, MRMC Gulbarga. Myself Dr. Deepa from SNMC Bagalkot.
Praveen from SNMC Bagalkot.
I'm Dr. Noman, third year PG, Dr. Bedriashini Hospital.
I'm Dr. Aishwarya, third year PG resident from Dr. Bidri's Ashwini.
Myself Nidhi, first year PG from SDM Medical College.
Myself Mahima, first year PG from SDM Medical College. Myself Sharvari, second year PG, KIMS Hubli. Shivaranjani, second year PG, KIMS Hubli. Myself Dr. Deepika from BLDE University. Myself Dr. Apura from BLDE.
Great. So all of you have received your question by examiners and answer sheets. Screening round contains 20 questions, 20 answers. Each right answer will score you 1 mark. Each wrong answer doesn't take any negative marking. In case of tie, we will go to second round of screening questions. Okay? 16 teams are there. You have next 20 minutes to complete the screening round. As soon as the time starts, we'll let you know. Okay? Then once it is done, we'll go for a break. Subsequently, the teams will be announced. If there is a tie or 8 teams have the same score, then we'll go for screening round 2. Are we clear? Any doubt? So, timer. What is the timer? 10:15. Okay, next 20 minutes. Let's start.
ಇದು ಟೇಬಲ್ಗೆ 5 ಮೈಕ್ ಅರೇಂಜ್ ಮಾಡಿ ಫಸ್ಟ್ ಇದು ಬಂದ್ ಮಾಡಿ.
ರಾಕೇಶ್ ಕೂರ್ ನಾಷ್ಟ ಮಾಡ್ಬೋದು ಕೂರ್ ನಾಷ್ಟ ಮಾಡ್ಬರು ಕೆಲಸ ಕೂರಿ ನಾಷ್ಟ ಮಾಡ್ಬೋದು ಕರ್ಕೊಂಡು ಹೋಗಿ ಟೂ ಆಫ್ ಎಷ್ಟು ಇದೆ ಕರ್ಕೊಂಡು ನೀವು ವಾಪಸ್ ಕಲೆಕ್ಟ್ ಮಾಡ್ತೀವಿ
ಹಲೋ 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 ಕಾಲರ್ ಮೈಕ್ ಒಂದು ಹಲೋ 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 ಬರೋಬರ
Guys, unfortunately, there is a tie. I never expected it will go to that round. In fact, I had a discussion with secretary also. We have a tie for one position. The two teams are. So I want team SNMC Bagalkot to come here.
SNMC Bagalkot.
They left for the day. Come no madam. One more is?
RIMS Raichur.
RIMC. RIMS. Yeah. You will have a screening tiebreaker round. Okay. There are, I guess, how many minutes? 5 questions. You will have. Nah, that there. Here on. No, answer sheet. We have answer sheet for that also. Answer sheet. Give answer sheet first. 5 minutes will give, not more than that. ಎಲ್ಲರಲ್ಲಿ ಒಂದು ಕೆಲಸ ಮಾಡಿ ನೀನು ಸ್ಕೋರರ್ ಆಗು ಅಲ್ಲೋಗಿ ಎಂಟ್ರ್ ಮಾಡೋ ಉಳಿದನ್ನ ಮಾಡಿ ಸ್ಕೋರರ್ ಆಗು. So it is a tiebreaker round. Okay, keep the no. Okay. For now, till we tell start. Okay. Kana, turn it around. Start madilappa now. See, for everyone's information, there are 6 positions or 6 teams to be selected. 16 of you participated. 5 have scored different marks. There is a competition for the 6th position or 6th team. So both SNMC Bagalkot and RIMS Raichur, if I am not wrong, correct? So have scored similar marks. They are fighting for the 6th position. We will put it in that way. They will have 5 question round, 5 minutes. Based on these answers, we will take it forward. If this also goes for tie, then it is difficult. I have to get one more chair now. Are we sure? Start. 5 minutes only. I pledge for 19 whichever award is given under this national program.
प्रधानमंत्री सुरक्षित मातृत्व अभियान.
No indirect marks, boss. Sorry about that. So team SNMC will get 10. Raichur, right? Rims Raichur will not get anything. Okay, one more question each set for you. Question 2 for team Raichur. Which colored biomedical waste container should be used to discard placenta?
Yellow color.
Okay, I hope you got that answer right. It's yellow, definitely yes. So they scored 10 again, 20. Hope for the best. Question 2 for you guys. In the first trimester, what parameter gives the most accurate assessment of gestational age? In the first trimester, what parameter gives the most accurate assessment of gestational age? Okay, let's
Ground rump length.
Let's CRL. Okay, sorry. Anyway, they will be qualifying for this now. Well played. Guys, change it back to that now. So, all the very best for the next time. Well played. We'll make. Give mic one system. I want you guys to announce. Please don't say marks. Micro. Aniket, you mic edkunbidu file. Only names which have been chosen, sir. No. SNMC is there, sir. Perfect.
Good morning, everyone. Congratulations to the participant who are like colleges who are win. I qualify for the next rounds. That is MRMC Gulbarga.
Class.
Just raise the hands. MRMC. Because I am from MRMC.
Hey, that is nowhere related to that.
BLD. Okay. Congratulations. Navodaya Medical College. Vims Bellary. Kims Hubli.
Kims, right?
Kims Hubli. And SNMC Bagalkot.
So 6 teams are final. To make it clear, it is MRMC Gulbarga,
BLD,
Navodaya Medical College Raichur, Vims Ballari, Kims Hubli, SNMC Bagalkot. Rims Raichur tried really well, but because of the tiebreaker, I think there are only 6 teams. Any questions on the screening modality before I begin the main quiz? Any one of you? I hope it is clear, transparent. The relay is being given to NNF also. Any doubts on any answer keys? I think it was circulated, Allah. Any answer keys, any doubts, any one of you? I hope no, right? Now we will go to inauguration, followed by we will allot the team, sir. I request the judges, Sir Gubar sir, but please, all of you come. We will have a group photo and then we will start the quiz. Rekha madam, Neeru. All of you please come forward. It is your quiz. Sir. Hey, come re. We'll begin, sir. Judges. Bharo. Okay, volunteers and PGs, one round. Hey, barro, bada. Each one call a member from each team, please come. Volunteers, why don't you come first? మీరు ఉడదాలు డూ ఇట్ టుడే ఓన్లీ. ಸರ್ ಬರ್ರಿ ನಿಂದ್ರ ಬರ್ರಿ ಒಂದು ಫೋಟೋ ಬರ್ರಿ ಇಲ್ಲಿ ಸೀನಾ ಎಷ್ಟು ನೀರು ಹಾಕೋ. Okay, teams who are not part of the quiz, we'll call them for inauguration. Please come, who have not been among remaining 6. Barry, please. Who are not in the main quiz. Hey, Barry, please. Hey, guys who are not part of the one, who have not won. Hey, Barro, you have given a good competition. Come soon. You have to start, man. Come now. Barry. Hey guys, come re, what are you waiting for? Sure, agree madam, please. We'll take a group photo now only. Better altogether. ಒಂದು 4 ಚೇರ್ಸ್ ಸಿಗ್ತಾವಿಲ್ಲ ಅವು ಪ್ಲಾಸ್ಟಿಕ್ ಚೇರ್ ನಾಯಿನೋ ಅದು ಹೇಳದವ ಓನ್ಲಿ 3 4 are there. 4 ಅದಾವ ಇನ್ನೊಂದು ಚಲೋ. You can see the camera, no? Library ಕೊಟ್ಟಿದ್ದಾರಲ್ಲ library. Okay. 6 teams are here with us. All 6 teams, please come forward. I hope we have given the names who are in the main quiz. Karthik, score kudni. Enter one. Meenakshi, second table. 6 team, 1 member from each team. You have to come forward now little bit for the camera purpose at least. 6 are there? Come ahead. Here. Kana, like this, facing this. 1 2 3 4 5. One more. ನಿಮ್ಮ ನಡು ನಿಂತು ಬಿಡು 6 ಜನರೊಳಗೆ ನೀನು ಒಬ್ಬ. ಚೂಸ್. Hey, 1 second. 3 4 5 6. 6 teams only. Who is extra now? 1 member from each team. Oh, you both are from the same team. Then you sit, madam, please. See, this what we are doing is for the A, B, C, D, E, F. That is also by choice. It is not defined earlier. You have to take the mic, announce your, give them the mic, Ray. Aniket. Yeah. You announce your team and then go back to your chairs.
Team B.
B, yeah, please.
Team F.
Okay.
Team A.
Great.
Team C.
Okay.
Team E.
Okay.
Team D.
Team
D, sir, D.
D. Great. Vivek, phone. ಏನು ಮಾಡತ್ತೀವು? We'll start from team A. Let us introduce your team for the record purpose. Your name, from which medical college you come. Start.
Praveen from SNMC Bagalkot.
Yes.
Dr. Deepa from SNMC Bagalkot. Dr. Sushma from Navodaya Medical College, Raichur.
Dr. Shravani from Navodaya Medical College, Raichur.
Dr. Shivaranjani from KIMS Hubli.
Dr. Sharvari from KIMS Hubli.
Dr. Deepika from BLDE.
Dr. Apurva from BLDE. Dr. Pranali from MRMC Kalburgi.
Dr. Pooja from MRMC.
Dr. Faraz from Vims Ballari.
Dr. Shri from Vims Ballari.
I think let us share mics between the teams once you answer. Anyway, let us explain screen. So we welcome you all to the NNF quiz round, divisional round, Southeast Zone 6. Team of 6 best teams have been chosen. Okay, coming to the rules, there will be 6 rounds. Of these, the last round will be audio-visual round. Visual round. In the first 3 rounds, the order of question will be from A to F. In the next 3 rounds, the order of the question shall be from F to A. For uniformity and transparency. Each team shall get 6 direct questions. Each question, if you answer, you will get 10 marks, including the visual round. Whereas last round, which is the visual round, will have 2 questions. If you answer both, you will get 10 marks. If you answer one, you will get 5 marks. I hope I am clear. Okay. In addition, the teams can attempt to score indirect marks by writing answers. Example, if team A has been asked a question, if they don't answer, in the meantime, if you write your answer in the chits and give it to our team, if they don't answer, if you put a right answer, you will get 5 marks. That is an indirect answer, what we call it as. Okay. Are we clear on that? Great. So, but there will not be any indirect question for visual round. For last round, there is no indirect round. The participants will be provided paper slips to write. I hope you have got your respective paper slip with your team name on that. Clear? Chalo. You must mark your team identity, which is already being done for you. I hope it is A, B, C, D accordingly. You have got everything. I hope you have got pens. Pen? Okay. 10 seconds will be provided to each answer, each direct question. At times the timer might not work. Madam will be taking care of the buzz. As soon as she bells, the time will be over. Stipulated time count will start at the end of the quiz facilitator's question and ends at 10 seconds, which will be signaled by the timekeeper by sounding the bell. During the same time period of 10 seconds, all other teams shall write their answers on a paper slip and give it. You will not be given extra time for that. Are we clear on this? Okay. The slips will be collected from all the other teams after 10 seconds and scrutinized by the quiz facilitator. All teams who write the correct answer shall be given 5 marks each. So the chits go to the judges. Judges will tell us which will be the right answer and they will be given marks according to that. Okay. However, if the direct question has been answered correctly by the team to which the questions was primarily addressed, the slips will not be considered. Are we clear? If team A answers, then there will be no roll of slips in there. Okay. Okay. There is a tiebreaker round if required, that we will be discussing later. Okay. Yeah. Round 1. Any queries? I hope everyone is clear. It starts from A to F, F to A. If there is any discrepancy in answers, for example, if A team doesn't answer, if it goes to chits, you pass your answer, it will be final judge of the facilitators or quiz masters or judges whose decision will be considered final. Are we clear on that? Chalo, with the permission of judges, let's start. Round 1. Team A, as per NRP 2020, below what gestational age cord milking is not recommended? Okay, A team has not answered that. Let us wait for the slips. Sir, I'll go to the answer. The answer is 28 weeks of gestation. Please utter a word. Don't, whatever you know, just say. If 2 of you answer, imagine she says 28, he says 30, you will have 30 seconds to give the final answer. As being a host, I am not going to react in any way till 10 seconds are over. You have to say within 10 seconds. After 10 seconds, that answer will not be considered. So,
question was less than 28. So, team D less than 28 weeks.
Okay.
Correct. Team E less than 28 weeks. Correct.
Okay.
Team C less than 28 weeks. So, team B has written less than 24 weeks and team F has written less than 32 weeks. Both are wrong. So, scorers, please note down.
Okay. Sir, 1 second, I just got a call from Central NNF. Okay. So, which teams get the marks?
D, B, and E.
One of you can hold, sir, mic please. Team?
Team C,
Plus 5. Team?
Team C 5, Team D 5, Team E 5.
C, D and E get 5 marks each. I hope now the pattern is clear for you guys. No confusion. Okay. Chalo. Let's go to the second round. When does posterior neuropore close? When does posterior neuropore close? We'll wait for the slips. Sorry. 27 to 28th the day of life, that is 4 weeks is the answer, sir.
Team F has answered 4 to 6 weeks. Team A 18 to 20 weeks. Team E has answered 8 to 10 weeks wrong. Team C 12 weeks wrong. Team D, it is sixth after 6 weeks. So this is also wrong. So Team F qualifies for marks, that is 4 to 6 weeks.
Okay, Team F gets first indirect 5 marks. Okay, let's move on to the direct question to Team C. What is the typical metabolic abnormality in neonates with congenital hypertrophic pyloric stenosis? It's not acidosis, stenosis. Typical metabolic abnormality in neonates with congenital hypertrophic pyloric stenosis.
Hyperchloremic
metabolic alkalosis, hyperchloremic metabolic alkalosis.
You have to be a little more clear. I'll give you 2 seconds more.
Hyperchloremic hyponatremic metabolic alkalosis.
Okay, let's see. I was expecting hypokalemia. Will not take that answer. Indirect. Sir, hypochloremic, hypokalemic, metabolic alkalosis is the complete answer, sir. We are looking for. Sir, announce.
He has answered hypochloremic, hypokalemic, metabolic alkalosis.
Okay.
So other teams have not given the complete answer.
No, answer. Read all, sir.
Team D will get the marks. Team A, hypochloremic, metabolic alkalosis. So hypokalemia is missing. So Team B, hyper -- metabolic alkalosis, incomplete. So Team F, metabolic alkalosis, incomplete. So Team E, hyponatremia, hypokalemia, hypochloremia, alkalosis, wrong. So Team D will get 5 marks.
Okay, done. It has to be a complete answer, mind you guys. Okay. Team D, direct question. What is the surfactant pool size of neonates at term gestation?
100 mg per kg. 100 mg per kg.
I have to wait for the timer, madam. Yeah, it's 100 ml per kg. Direct question. Team D gets 10 marks each. I think audience can clap. You want me to get chocolates for you? Let us encourage our team here. Team E, direct question. What does IO stand for in the mnemonic cardio in neonatal resuscitation? What does IO stand for in cardio? Chits. Sir, yes, sir, please read, sir. Inhaled oxygen during chest compression. start again. Sir, anyone? You have to be louder, sir, please. Anyone? No one. It is nothing but inhaled oxygen during chest compression. I hope it is a new update mark. Tough question. I understand that. Coming to team F, what is the Bezet's formula to calculate QTC interval?
Total is equal to QT interval divided by RR interval square root, sir.
Great. Nice answer. Good one. Okay. In the meantime, the scorers, let them do their job. We have audience round also. We have surprise complimentary gifts for audiences. All other teams, if you answer these, let us see which teams. Let us take it as in a team manner. You are not allowed to answer these things. Scorers, you do your job. As soon as they get, you display the score. Okay, what happens to heart rate and blood pressure of a fetus in utero during primary apnea? What happens to heart rate and blood pressure of a fetus in utero during primary apnea? Mike pass madam. Give a try, man. What are you going to lose? Sorry? Okay. Bradycardia and both will decrease, you are saying. Bradycardia and hypotension. Okay. Anyone else? Heart rate falls to 100 beats per minute and blood pressure transiently rises before falling. The answer was blood pressure will not fall immediately. It's a transient rise followed by fall. But I'll give it to you. We are just waiting. Chocolates. Okay, name a condition for which McGowan nipple is used for airway management. You want to be more specific? The answer is bilateral choanal atresia. Perfectly fine. Great answer. So scores at the end of round 1. Team A has not opened the account yet. Team B has not opened the account yet. Team C 5, Team D 20, Team E 5, Team F 15. Congratulations. So round 2 will again start from A to F. I hope there are no queries now. Guys, are we clear on this? Anyone has any questions from the audience? Let us start. Great. Team A, name 2 interventions to be used in the delivery room to improve NICU admission temperature of a 30-week baby. 2 delivery room interventions to improve NICU admission temperature.
Skin to skin contact.
10 steps of warm chain.
Skin to skin contact. One more is?
Warm delivery. Warm chain.
Skin to skin contact and 10 steps of KMC.
Okay. Let us see. It is nothing but plastic wrap, exothermic mattress and heated humidified oxygen. 30 weeks baby is delivered. You are transporting it from your labor room to NICU. How do you maintain the admission temperature at a normal range? You either receive it in a plastic polythene wrap, which most of us know that a 30 week or below has to be done, or you use an exothermic mattress or what you call the incubator, new thing what we have got, and oxygen whatever you use has to be humidified one. Okay, sir.
So team D has answered delivery room CPAP, early surfactant administration. So team B wrapping, wrong. So team F close the doors and windows and skin, wrong. So team E skin to skin contact and warmer for 20 minutes. So team C, so plastic cover and skin to skin contact.
One is right, but both are not right. We
Both
can't
are.
take them. Alva? So nobody gets any marks. I hope we are clear on that. Team B, direct question. Immediate kangaroo mother care is an evidence-based intervention to improve survival of a low birth weight neonate. How do you define IKMC? Anything which we start KMC within 2 hours of life and continue it up to 24 hours per day, 20 hours per day, sorry. KMC has to be started within 2 hours of life and it has to be continuously given up to 20 hours per day.
So team F has answered immediate KMC if no symptoms, not oxygen. No, this is not correct. Team D, NICU KMC, wrong. Team C, just after 1. This is also not correct. So team E, immediately after birth, skin to skin contact. So they have to specify. So
We'll
team
keep it
E.
on the right hand side, sir. Okay. Others, nobody has attempted. What was the team, sir?
Team E, immediately after birth.
What should we do? It has to be specific within 2 hours and up to 20 hours per day. Will not take it, sir. Nobody gets any marks on that. Okay, it was a direct question for team B. Now we'll go for a direct question for team C. What is an essential criterion to define clinical chorioamnitis? Essential criteria to define clinical chorioamnitis.
Foul smelling liquor. Foul smelling liquor.
Essential criteria.
Team F has answered temperature more than 30, increased WBC count.
100.4, sir.
Team E, PV leak more than 18 hours and foul smelling liquor. Team A, fever, abdominal tenderness, foul smelling. Team D, fetal tachycardia, maternal fever. No, they have not mentioned 100.
It has to be maternal fever more than 100.4 degree Fahrenheit or 38.3 degree Fahrenheit Celsius.
Sir, they have written 39 degree Celsius.
No, that we can. 39 is nothing but
100
degree Celsius, that is Fahrenheit. Who is it? Team?
Team F.
Team F. Yes, they'll get marks. Definitely. Good one. Temperature. It has to be there.
Maternal fever we have written.
Correct, I know.
But you should specify, no?
Temperature has to be there. Okay, so team F will get
5 marks.
See, we are fighting for a competition. It has to be specific. Whatever answer comes, if that is somewhere nearby, we can take it. But if you justify maternal fever, what? That will be the next thing for us. Okay. Team D, direct question. What is the classical surgical procedure performed in a neonate with duodenal atresia? Classical surgical procedure performed in a neonate with duodenal atresia.
Slips should be collected immediately.
Answer is duodenostomy. Team E has answered ileotomy. Is was correct? Wrong. That's what. A has answered hepatojejunectomy. That is wrong. C is end-to-end anastomosis. That is also wrong. And team F has answered duodenostomy. So can be duodenostomy, but they have mentioned only duodenostomy. Spelling.
Which is that? Team?
Team F.
Others, sir?
Others they are wrong.
Duodenostomy we can take it.
Yes.
That should be fine.
Team F.
Kimura's is this thing that we can take it.
So please write the answers clearly.
Legibly, so that they can read. Okay? So team F got one more mark. Yes. What you have guys have written? What? Of jejunum, duodenum, ileum. Only thing why I am giving them is it's a duodenal part stomy, what they are saying. We'll take service. Team E, direct question. Name the medicine commonly used for prophylaxis of respiratory syncytial virus infection in preterm neonates. Medicine commonly used for RSV prophylaxis in preterm neonates.
Acyclovir.
Yes, sorry, my bad. It's pembrolizumab.
A has answered, no one has answered correctly.
Okay.
A has answered ribavirin, and B olistamivir, C olistamivir, D ribavirin, and F ribavirin.
Okay, so no
So
one
no
gets
one
the
will get the
marks.
marks.
Team F, direct question for you guys. Name any two hyperbilirubinemia related neurotoxicity risk factors.
Preterm and perinatal asphyxia and hyperbilirubinemia.
Urinary cholestasis.
Hyperbilirubinemia related. Preterm and perinatal asphyxia.
Any two of
Sepsis.
the following: if the gestation age is less than 38 weeks, albumin less than 3 grams per deciliter, isomin hemolytic disease, G6PD deficiency, or any other hemolytic condition, sepsis, significant clinical instability in the previous 24 hours. Sir, answers. Sir,
Team A has answered preterm and birth asphyxia.
doesn't fit into. Next.
Team D has answered G6PD deficiency, immune hemolytic anemia, hyperthermia, and sepsis. So
Yes.
can be
Right
taken.
side.
D. D.
I think I did completely.
Yes.
Whichever are right. Huh?
E has answered preterm, RH incompatibility, IUGR, sepsis.
Yes, sir.
Can be
Right
taken.
side.
So, and team B has answered gestation age. So it is can't take.
So two teams will get marks for that.
D and
because-
E.
Sorry?
D and E.
We have
D and
also
E,
answered
yes.
preterm.
So E.
No sir, we are F. The direct
we-
question is for us.
Preterm you have answered one more.
And perinatal asphyxia. With
Asphyxia
sepsis.
doesn't come into picture.
But I
Half.
It has to be a complete answer. This is not a sixth round. There is a single question, two factors has to be answered completely. Okay? Shalom. So who will get marks in this? D and E. Team D, T, F, D and E get 5 marks each in that. Okay, I think we are done with the second round. We'll leave the job to scorers. We'll go to the audience again. A newborn baby delivers at 38 weeks of gestation with a birth weight of 2.5 kilos. What is the interpretation of this growth chart? One is at 38. Okay, sorry. Anyone? A mic order, please. Sorry? Okay, anything else? Definitely a small for gestational age baby. Identify the equipment, name the body part where it should be attached for measurement. Great, it is transcutaneous bilirubinometer, forehead or upper end of the sternum for that matter. Okay, scores at the end of round 2. Scorers. So I think you can announce if you have mic.
Team A 0, Team B 0, Team Team C 5, Team D 25, Team E 10, Team F 25.
Okay, great. So guys, mind you, in this score, when we are putting this second round, this is the cumulative marks. This is at the end of second round, you have scored 25. This doesn't mean this is 25 plus 20, 45. Are we clear on that? No confusion, no? Yeah. It is, this is the final marks at the end of score, at the end of round 2. No confusion in that, right? Or should we put it 5-5 only? It's okay? Hope you understood what I am trying to say. Okay? At the end of round 2, the final score, I'll announce it again. Team A is yet to open up the account. Team B 0. Team C it is 5 marks. Team D 25. Team E 10. Team F 25. So D and F are having good competition. Let us move to third round, guys. Back. So third round we'll start from Team A again. All the best, guys. A term neonate is on a ventilator with a MAP, mean airway pressure of 12, FiO2 100%, blood gas shows PaO2 50 mm Hg. Calculate baby's oxygenation index. MAP 12, FiO2 100, blood gas shows PaO2 50.
4.2.
Okay, let's see. It's 24.
So Team C 24, right, correct answer.
Great.
Team F 24, correct answer. Team E 24, correct answer. Team D 24. So Team C, D, E, F.
Okay, C, D, E, F have got 24. You have not discussed, no guys? All 4 have answered. Not bad. Okay. Guys, why don't we clap? It was a good one. Alright. Okay, Team B, what are typical MRI findings of acute bilirubin encephalopathy in a neonate?
Involvement of basal ganglion. Basal ganglion.
Answer matter ಕೊಟ್ಬಿಡು. Keep it for the next round. Your own team, ಇನ್ನೊಬ್ಬರು answer. So,
Involvement of basal ganglion.
involvement of?
Basal ganglion.
Basal ganglia.
Okay. Then, bilateral hyperintense signal of T2 weighted sequences in globus pallidus and thalamus. If you had said globus pallidus and thalamus, I would have taken it, madam. Basal ganglia is a too broad terminology. I am not expecting you to tell T2 weighted images, but at least basal ganglia, the globus pallidus and thalamus should have been there. Okay, sir, over to you. Team? I was not. See, why we are not taking basal ganglia is it's a very broad thing. People have answered hyperintensity and they have answered basal ganglia. Issue is we expected either globus pallidus or thalamus, either of them. Okay, now we'll move to the direct question. Team C, a 27-week preterm neonate stable on CPAP developed respiratory deterioration with a feed intolerance on day of life 12. Echo was done and baby was found to have 2.9 mm PDA with a pulsatile flow pattern and absent blood flow in the celiac artery. How will you treat this baby?
NPO and paracetamol. For
Perorally and paracetamol.
12.
Okay. Medical therapy with IV paracetamol or indomethacin. So I'll leave it to judges now. NPO, I totally agree. Most of us should we take paracetamol or should we go particularly for IV and oral? Sir, direct answer discussion normal. Team C has told nil per orally and paracetamol. I think we can take
Yes,
that
sir,
probably,
yes.
right?
Yes.
We'll take that as a direct answer.
Direct
No
answer.
need of it. Good one. So indirect baradilla. Okay. So Team D, direct question to you guys. When do you label pulse oximetry screening for critical congenital heart disease as fail on first measurement?
If difference is more than 3%, right upper limb and right lower limb, if difference is more than 3%. Preductal and postductal more than 3%.
Okay, let's see what they have given to us. I hope everyone has given your chits. Chits are done? Chits are given? Okay. SpO2 of less than 89% in the either right hand or foot. What you said, madam, was for PPHN. Here we are going to identify congenital heart disease where the preductal saturation below 90 or less than or equal to 89 is considered pulse oximetry test failure where you are supposed to go for echo. Sir, over to you.
So Team E more than 3%, right and left wrong. So Team F SpO2 less than 94%, difference more than 10% wrong. So Team A SpO2 more than 95% and difference more than 5% wrong. So Team C 24 weeks wrong.
Guys, please try to read the question. It is a pulse oximetry screening test. They did not ask you for oximetry test for PPHN. Okay? Most of you knew this answer. Probably you read that question wrong. Okay? We'll go to the next question. Team E, direct question. Ready? Yeah. To manage possible serious bacterial infection in young infants when referral is not feasible, Ministry of Health, Family Welfare, Government of India issued guideline for auxiliary nurse and midwife in 2014. According to this, the recommended drug for fast breathing young infants from 7 days of life to 3 months of age is?
Ampicillin, IV ampicillin.
The recommended drug for fast breathing infants is? Say that again, what you said, we could not hear.
Injection ampicillin.
Injection?
Ampicillin.
Ampicillin. Okay. Chits, are we done? Okay.
So team A,
I thought
A
you
has
will correct that. I heard in the first place. 1 second, sir. I thought you will correct that. That is the reason I asked you again. You are a close one, but she said IV ampicillin. We can't take that. That is a problem.
So team A has answered amikacin without any roots, so wrong. So team B has given amoxicillin syrup, so that can be taken.
Yes.
So team C has not mentioned the root, so only ampicillin. That's not correct. So injection amox and injection gentamicin team F, that's again wrong. So team D has answered IV ampicillin and gentamicin, again it's wrong. So team B gets marks.
Team B.
B.
Oh, good. You opened your account. Nice. Please be specific when a drug is being asked, the modality of giving, because it's a grading system. Okay. Team F, direct question to you guys again. Which tool is used to measure fentanyl withdrawal in infants on prolonged mechanical ventilation? Which tool is used to measure fentanyl withdrawal in infants on prolonged mechanical ventilation?
Capnography. Capnography.
Chits, sorry? Capnography, yeah. We'll see that. It's nothing but Finnegan neonatal abstinence scoring system. Tough one. I can't do anything. They have decided the question. If you had said abstinence scoring system also, I would have taken it. I was not expecting Finnegan. Okay? Anyone, sir?
No, sir.
I think difficult, I guess. That was difficult one. So, round 3, we are done. We'll come back to our, hope you got your chocolates, guys. Whoever has answered, nice. Now at least you can clap for us. Right? Great. So, audience round, till the scorers do their job. Above what oxygenation index one cell considered ECMO as the treatment modality in ventilated neonate?
More than 30.
Can you be more specific?
More than 30.
What? 40? Mic would row.
More than 30. 40.
Of what?
OI is index, sir. It need not be percentage, only
Oxygen
40.
index of more than 40 measured at 2 different intervals at 1 hour apart. Because of want of time, they have not written. Okay. Oh, NTL method is used to calculate the depth of ET tube insertion. How do you measure NTL? That is a full form. How do you measure? The answer is tip of septum to tragus. As simple as that. They expected you to answer the tip. Okay. Okay, great. Scores at the end of round 3. Back to scorers.
Team A 0, Team B 5.
One second. Team C should be 20, Ray Karthik. 1 second, madam.
20 only, sir.
Oh, sorry. Yours is done.
Team C 20, Team D 35, Team E 15, Team F 30.
Okay, good one. So team D is leading, followed by team F. Hope there will be a healthy competition. At the end of 3 rounds, the scores are clear. Any questions, any queries? Audience, are we transparent enough? Anything to be addressed to? Great. You need a break? Let's continue. Okay, round 4, it starts from F to A. Clear? Great. Team F, an RH isoimmunized mother delivers a newborn at term gestation. The cord bilirubin is 7 mg per deciliter and the blood group is O positive with a positive direct Coombs test. What should be the most appropriate choice of blood preparation for double volume exchange transfusion in this neonate? Please read the question properly.
Sir, his own,
Sorry?
the O positive blood group is the first choice, sir.
Choice of blood preparation.
Sir, O negative blood group with AB plasma, suspended in AB plasma.
O negative blood with AB plasma. Okay, we'll see what is the answer. O negative PRBC suspended in AB plasma. We'll give it to you. Please try to use the word PRBC. Okay, that was close. I hope others don't disagree on that. Okay, team E, guys ready? Direct question. A female term newborn weighing 2.1 kilo is delivered to a mother with preeclampsia. The neonate looks plethoric and noted to have a hematocrit of 73% at 2 hours of life. No other symptoms are observed. What is the most appropriate management for this neonate?
Partial exchange.
73% at 2 hours of life, asymptomatic.
Partial exchange.
Most appropriate management. So they have said partial exchange. Chits, are we done? Great. Increase fluid intake. The clue, the deciding factor was it is asymptomatic. If it is symptomatic, they would have gone for partial exchange. That is why I said again. Anyone else?
Team A has answered increase IV fluids.
Great.
Can be taken. And team C, wait and watch.
Sir? Huh? Pardon. They have given boss. I can't do anything about it. But andru answer madilla. Yen madakagalla. They should have taken that. Okay.
Team C has answered wait and watch. So wrong. F has answered IV hydration fluid.
Correct. Okay.
Can be
Yeah.
taken, sir.
IV fluids.
Yes. And D has a bolus 10 ml per kg partial exchange. So wrong. So A and F can get the answer.
Okay. A and F gets 5 marks. Ishtu kotru madilla nodi yen ಮಾಡ್ತಾರೆ. Everyone should have answered no then. See, it is very clearly it was asymptomatic.
One doubt.
Sir.
So
No, they did not. The idea was not clear. If they had written only increased fluid intake, we would have taken it. When they say partial also, that means they think symptomatic. Then we can take their answer directly. I hope things are clear. Okay. So who gets the marks?
A and F.
Sorry? A and F gets. Okay, great. That should be fine. Okay. Team D, direct question to you guys. A 8-day-old term neonate presents with lethargy, poor feeding, and respiratory distress. After admission, the neonate is noted to be anuric with deranged renal function tests and hyperkalemia. The clinical team performs peritoneal dialysis to elevate the symptoms. What is the most likely stage of acute kidney injury as per KDIGO guidelines?
Stage 3.
You are not allowed.
Stage 3.
Stage 3. Okay, let's see. Question barbo. Screen mein. Bartila.
Sir, answer stage 3
Video.
was answer. Stage 3.
Great.
Correct.
It's safe. It was quite easy. Hello, Adil. Display that. All the question cannot matter. Question ಬರ್ತಾ ಇಲ್ಲ ಸ್ಕ್ರೀನ್ ಈಗ ನೋಡಿ ಅವ್ರಿಗೇನು ಕ್ಯಾಮ್ರಾ ಅವ್ರಿಗೇನು ಕಾಣಿಸ್ತದೆ ತೋರಿಸು ಇದೆಷ್ಟು ಕಾಣುತ್ತೆ
anyone is feeling hypoglycemic, so you can get chocolates.
Sorry for the inconvenience. Team C, direct question to you guys. A 36-week-old newborn born to a primigavida mother with uneventful delivery was kept under observation for mild respiratory distress. Blood glucose level checked at 6 hours before feeds was 22 mg per deciliter. However, the baby was asymptomatic. What is the next step in management?
Feeds. Give the feeds and recheck after 1 hour.
Okay, you want to feed the baby and reassess again. Yeah. Chits?
Answer. Answer.
Continue interfield and check blood sugar at 1 hour. Good one. So team C gets direct 10 marks. Good one. Now coming to team B, a 38-week neonate was born to a mother with thick meconium stained liquor. Baby had no respiratory effort and was limp. Initial steps of resuscitation was done, but the baby was gasping. Baby was started on mechanical ventilation with SpO2 and ECG monitor connected. Heart rate was noted to be 80 beats per minute and SpO2 was 86% at 5 minutes with a baby having good chest rise with bag and mask ventilation. What is the next step?
Continue CPAPs.
Continue?
Positive pressure ventilation.
Okay, continue PPV, positive pressure or bag and mask ventilation. You want to continue that. Okay, chits are done. Put alternate airway intubation and OG tube placement. The issue is just they were not happy with the chest rise. Okay? Saturation was not adequate. 86% at the end of that. Heart rate was less than 100, saturation was 86. Heart rate should have been above 100. I know, heart rate is less than 100. Fine. Heart rate should have been above 100, boss. At the end of 5 minutes, the heart rate, in spite of you are giving bag and mask ventilation, at 5 minutes of resuscitation, heart rate should have been above 100. The problem is still in bradycardia. You have given 5 minutes positive pressure ventilation. If you continue doing that, again it will go into further brady. As simple as that. They have not asked you to give adrenaline. They have asked you to intubate the child. Because you have given 5 minutes bag and mask, they want you to put a OG tube and remove air from the tummy. The glitch here was 86, they gave a good number. And they said chest rise was there. But you have to note what? Heart rate should have been above 100. If heart rate was above 100, definitely yes. Continue positive pressure ventilation. Are we clear? I hope things are clear. Great. Sir, chits.
So team F has answered continue bag and mask. Team A wait and watch. So team D has answered continue bag. So team C same continue. So shift to NICU for post-traumatic, that is team E. So nobody has intubation.
Okay, if you had written intubation, we would have taken that. Okay, so team B doesn't get any marks. We'll move to team A. That question to you guys. A term neonate bilateral cleft lip and palate is delivered to an unbooked mother with a rheumatic heart disease. What is the most likely cause? Bilateral cleft lip palate born to a RHD mother.
Penicillin.
Sorry?
Penicillin injection.
Okay. Could be secondary to penicillin. Okay. Let's see. What is the answer? Chits. Are we done, guys? Fetal warfarin syndrome, madam. Anyone? Sorry? Okay, no one gets any marks as of now. We'll leave the job to scorers. Audience, which congenital cardiac condition undergoes spontaneous resolution in IDM mothers? After heart. Okay. Good one. You should have been here, man. Chocolate kodro. Wake up note today only. Okay, one more round. Top baby. You last answer matrapa. Brother chance kodri. Ella chocolate niyo tondo illo. A term baby delivered by emergency LSCS was found to have hypotonia, low set ears and rocker bottom feet. Baby had greyish blue skin, gradually progressed to shock. What is the diagnosis? What do you think was the clincher here? What do you guys said? What did you guys say? They wanted a duct dependent lesion rather than saying anything else. Problem enagtada unless until you do echo you are not sure what it fits into. Alva? Why duct dependent? Feeble. As simple as that. Okay? Scorer.
Team A 5, Team B 5, Team C 30, Team D 45, Team E 15, Team F 45.
Great. I think we are going for tiebreaker again. Let's see. Other teams, you have still 2 rounds. You can really cope up. There is a chance. Please fight for it. Some mistake, man. All the best. Adu hudugiyaru mathematics parangilla prove ಮಾಡ್ತಾರೆ ನಾವು. Okay. Round 5. Are we ready? Starts with team F. Ready? Yeah. Name a rhinoprotective agent used in perinatal asphyxia. Chits. The terminology is the problem here. I think most of you know the answer. Theophylline or methylxanthine? We are doing a study on this aminophylline RCT. It is one of the newer modalities. Probably it will come in your textbook in another 1 year. Our own center was a part of RCT. Aminophylline has been found to be beneficial as a rhinoprotective agent in asphyxiated patients. Given at a loading dose of 5 mg followed by 2 mg per kg per dose 8th hourly for 3 days. 5 mg at admission, 2 mg per kg per dose 8th hourly. We did RCT where we give placebo to one set of infants and aminophylline to other. Basically we measured rhinoprotective effects in terms of biomarkers also. They had very good results. Okay. Team E. Name a hormone that has been evaluated for neuroprotection of a preterm neonate. Hormone evaluated for neuroprotection of preterm neonate.
Cortisol.
Cortisol. Okay. Chits. You had written previously. Some of you had written erythropoietin.
So team D has answered growth hormone. Team A wrong. Team A TSH wrong. So team F dexamethasone and serotonin wrong. So team C has answered correctly erythropoietin. So team C will get 5 marks.
So team C gets 5 marks. Okay, team D, direct question to you guys. In a IRH isoimmunized pregnancy, what is the indication of intrauterine transfusion based on Doppler? Isoimmunized mother, indication for intrauterine transfusion.
HB less than 10, cod bilirubin more than 5.
HB less than 10?
Cod bilirubin more than 5.
More than 5. Okay, let us see. Chits, guys. So, MCS peak velocity of more than 1.5. I was not expecting you to tell mom, but at least more than 1.5. Mean cerebral artery. Middle cerebral artery. PSP.
So team A has answered increased MCA flow. They are not specified, but they are eligible.
I think we'll take that. Good one.
Team A. So other teams have not answered.
Team A gets 5 marks. Now we'll move to team C. Direct question to you guys. Name a drug that can be used to augment the effect of surfactant for the treatment of RDS. Drug used to augment the effect of surfactant for treatment of RDS.
Caffeine.
Sorry?
Caffeine.
Caffeine. Okay, let's see. Chits. देखा मैडम सब AC ನೋಡ್ರಿ ಕೆಲಸ ಮಾಡತ್ತಿಲ್ಲ ಅನ್ಸದ inhaled budesonide mixed with surfactant.
Answered, sir.
Again we are doing a study on this. Dr. Vijayalakshmi madam had given us this idea. Budesonide has been shown to be useful in neonates who have been given with surfactant. And I think one of your juniors presented in last SARS. Who presented budesonide? Sorry? Shri. But by the way, questions are not formulated by me. Let us be clear on that. Team B, which organism is implicated for recent epidemic of congenital microcephaly? Which organism is implicated for recent epidemic of congenital microcephaly? Aram se, no hurry, relax.
So, slips given lately will not be considered.
Sorry, sir.
So, team F, CMV congenital toxoplasma wrong. So, team E, Zika, so 5 marks. So, team D, CMV and Zika. Okay. So, team A, Ebola, it's wrong. Team C, CMV. So, team D and E will get 5 marks.
We have taken Zika as the answer. Chalo. Team A, which one? Sorry. You guys discussed or what? Right? Okay, we'll move on to the next round. Next set. Team A, direct question. According to neoprom trial, what should be target oxygen saturation levels?
%. 89%.
Okay, let us wait for the chits. Are we done?
91 to 90.
91 to 95.
So, team D has answered 90 to 95%, so can be taken. Other are answered 82, 92.
Sir, here. On answer it. For record, it will be there. Live
So, E has answered more than 92%, D 85 to 90, E 88%, and C 95%. So, team D has answered 90 to 95.
Given range, I would have taken that. Anything between 90 to 95 is the right answer. For target oxidation saturation, the part of the trial was to understand, reduce the incidence of ROP and reduce the incidence of death. When oxygenation was more, saturation was more than 95, ROP was quite high. When the saturation went below 90, death was more. So that is how 91 to 95 came into picture. Okay? Madam, you will do your job?
Sir, we have written more than 92%.
Exactly, it can be 100 also. 105 also. And please, whenever they ask you some targets, it will be in variable, two values. 80, 85, 90, 95, some range. Please keep in mind. Sorry, audience round. What is this equipment called? The clue is CPAP. Okay. What should be the characteristics of blood used for intrauterine transfusion? What should be the characteristics of blood used? Mike, one of you.
Sir, HEPA filter should be used and it should be screened for HIV and HPH. Sir.
O negative irradiated PRBC. Are we clear? Scores, guys.
Team A 10, Team B 5, Team C 35, Team D 55, Team E 20, Team F 45.
Great. So I hope there is a tough competition between D and F. Yeah, one more round, guys. Come on. You can do better. Any break? Let's go for the final one. I am telling you again, there will be no slips in this round, no indirect answers. Each question will have two questions, two sub questions, A and B. If you answer one right now, you will get 5. If you answer both, you will get 10. No confusion. So no pass marks here. Are we clear? And it's a visual round. If you can't see, please ask. Madam, 20 seconds for this round. We'll keep it 20 seconds. Obviously, boss. No. One set of there will be only one question for you. In that, there will be 2 sub questions. Okay? Once you see that, you'll come to know. Over to you. A late preterm neonate with respiratory distress on CPAP developed bilious aspirates with abdominal distension. X-ray abdomen done is shown below. What is the diagnosis? The clue here is this and this.
Nematosis intestinalis. Necrotizing enterocolitis, stage 2. Nematosis intestinalis.
What is the diagnosis?
Sir, NEC stage 2A.
Gastric pneumatosis. This is the answer they were looking for. Stomach. Tin rim here. This is the intestinal part. Okay. So that is a good one. Gastric pneumatosis. New learning for me also. Okay. We'll go to team E. Direct question to you guys. A pregnant mother with RH isomenized pregnancy is undergoing antenatal Doppler. Which vessel is being scanned here? Antenatal Doppler in RH negative pregnancy. What is the vessel being scanned? MCA. We had answered this, no?
Repeat question.
Peak systolic velocity with MCA. Okay? Great. You want to drink water, ma? Before we go? Team D, direct question. A pregnant woman undergoes a fetal ultrasound examination at 32 weeks of gestation. The radiologist notes bilateral hydrouretronephrosis in the fetus with radiological sign of the bladder as shown below. Which of the following is the most likely diagnosis in this case? Sorry? Okay. That was easy. Good one. Identify the condition. You have got 20 seconds. Take your time. Give a try.
Anterior progressive retinopathy.
ROP.
Maru.
Let's see. Pulse disease. Okay. Team B, ready? A neonate came in the emergency with lethargy and poor feeding along with skin lesions shown in the following figure. What is the diagnosis? Lethargy, not feeding well with skin lesions. Give a try. What are you going to lose?
Cray baby. Cray baby syndrome.
Sorry? Okay. Let's say purpura fulminans. Okay? So team A, ready? Developmental supportive care aims to create a structured environment as similar as possible to the womb that provides care and support to these babies, helping them to organize their state of mind, reduce negative impact and develop appropriate for better outcomes. What is the following? Which of the following aspects of developmental supportive care is shown by the healthcare staff in the image? What are the components of DSC you are seeing in the image? ಅವ್ರು ಆನ್ಸರ್ ಮಾಡಲಿ. Okay. Facilitated tuck or containment. Okay. When you want to do a procedure, if baby is irritable or something, if you want to examine, the clue is scalp and abdomen with warm hands. That will reduce most of their pain. Madam, start your job. Which procedure is depicted here? What is it called? Micro. Ex vitro intrapartum treatment. Exit. Most of us know exit, but we don't know the full form of it. Probably that was the reason why they've given that. Identify the clinical condition. What is 4Ds as per Rashtriya Bal Swastha Karyakrama? 4D, sir. One of you guys.
Congenital hypothyroidism, congenital adrenal hyperplasia, galactosemia, and C16 inhibition.
Okay. Defects, disease, deficiency, developmental delay. 4Ds. Avrdu tappala? I better. What those fellows have written on that? I am shocked actually. Okay, nothing to say. At the end of final 6 rounds, these rounds are decided by NNF. We got half an hour prior all these questions. If you want, you can come back and check in the computer. And there are screening tests, they had given the code for us. So I hope it was transparent. I never expected our team to win because last time it was SDM Dharwad probably, right? SDM Dharwad has come this time. Your seniors had won if I am not wrong. SDM Dharwad, there was one girl who was very this. So at the end of 6 rounds, I want judges to announce the scores for us. A mic order by Madam, can you pass the mark for us? Pass that mic to everyone.
So team B has scored 5 marks. So team A has scored 10 marks. So team E has scored 20 marks. And team C has scored 35 marks. So team F, that is 45 marks, runner-up team. So team D has won this competition. That is our beloved students Deepika and Purva.
You want to try tiebreaker or let us wind it up? Yes, no? Yes. Great, let's see. Which electrolyte supplementation has been shown to improve somatic growth among BLDE fats? Great, this is tiebreaker. Everyone would have answered. What is the gestational cutoff to divide early onset IUGR from late onset IUGR? Great. That fellow is copied from last year's season. What is the minimum effective flux for standard phototherapy in microwatt per centimeter square per? Answer is 10. 10 minimum. Which condition is denoted by OAE and abnormal BERA in normal human screening? You want to check, see again? Great. In the first trimester, what parameter gives the most accurate assessment of? I think we are done. CRL, right? What is the principle of using? As per Papil's classification of IVH, what is grade 1? No IVH. In a neonatal ECMO, what is normal fractional shortening? 26 to 46. Done. Chalo, thank you guys. Now, as per routine, customary, we are supposed to take feedback from everyone. Sir, camera should go to them each. We'll start from team A. We want your feedback. What do you feel? Can you guys help us with the mic? Whoever our friends are there. Oi, mic. Vivek, why don't you get up? They're supposed to talk now, guys. Whatever you feel about the quiz, we'll wind up in another 15 minutes. Both of you talk.
It was a nice experience, sir, and it was informative, and it was transparent.
Whatever madam says is okay for you?
We have got to know some updates. Thank you, sir.
Chalo. Team you are from? I forgot, I missed that. Falco, done.
Sir, we got to know many new things, sir. We got to know many new things, sir. It was good.
Overall, it was a very nice experience and we wanted to have it.
Thank you. Ananya,
It was
two more
an
mics I want there.
informative session and we got to learn more things.
Informative you heard. Second one?
We got to learn, like,
Everyone got to learn. Really? Huh.
and it was transparent also.
Thank you. Actually, I'm shocked.
Many recent updates are there which we don't know, actually. Many recent updates are there which we don't know, actually.
Sir, it was a very well organized quiz and a nice infrastructure, sir. And
Really was
also,
good? That credit should be given to someone. Okay.
It was informative, sir.
Sir, we learned latest updates on how to and it also some more of clinical questions are also there. So it was improved our clinical.
See, last quiz, the question issue was there were a lot of expansions. So there was a discussion post quiz that how much people have to buy at that. So if you remember third, fourth, I can ask your seniors because if the questions are not been shared anywhere. Third, fourth, fifth round, they made it a clinical pattern this time totally. In fact, the last round also we thought there will be 2 sub questions. I have not seen the questions. I am reading it for the first time. I was not aware what questions were there also. I thought, in fact, I told you that there will be two questions in last, but it was only one because I read it for the first time. Okay. Third, fourth and fifth round, it was just expansion of concert and all that thing. This time they had put it a clinical pattern so that it will be easy for everyone who works in the ward. Our friends, mic control. Vivek. ಒಂದು ಕೊಡ್ರು ಈ ಕಡೆ ಮೈಕ್ ಅದು ಇಲ್ಲಿ ಈ ಕಾಲ್ ವಿಜಯ್ ಸರ್ ಮೇಡಮ್ ಪೂಜಾ ವಿಜಯ್ ಸರ್ ಬರಕ್ಕೆ ನಾಲ್ಕು ಇಟ್ಬಿಟ್ಟು ನಾಲ್ಕು ಸಾಹೇಬ್ರ ಫಸ್ಟ್ ಸ್ಲೈಡ್ ಹೋಗ್ಬಿಟ್ಟು ತರ್ಡ್
Sir, the tiebreaker round was the tiebreaker round questions were from previous year this NNF quiz, sir. We were unaware of that and we couldn't able to answer 2 questions.
Question is question. Whether it was
Yes,
say
but,
these no questions, none of them have been written yesterday night. Somewhere they would have asked this. IIP there will be overlap or previous 5 years. In your final exam also, do you think they will prepare a new question for you?
It's okay, sir, but
It is your presence of mind. In fact, that should have been more advantage to you rather than disadvantage. If you have come prepared reading previous year questions, it would have been easy for you. As simple as that. Hey, chocolate ಜಾಸ್ತಿ ತಗೊಂಡಿದ್ದಕ್ಕೆ ಹೇಳ್ಬೇಕ್ರಿ.
The quiz was well organized, sir. We got to know many more things and we got to know where we are. Some things will be lacking which won't be asked. So,
Not lacking. Let us learn every day. There are a lot of new things. Even 26 to 46 were new for me. The ECMO gradient. We thought it was 30%. They were very particular that 26 to 30, 46, right? There are many new things. Not all of us know everything every day. Okay? Others, wake up now. Quiz is over. You can wake up. You have to go back also, I feel. They don't talk in the afternoon, huh?
Sir, it was very well organized and informative, and also we got to learn a lot, sir. Even before coming to the quiz, we studied a lot, so even though we couldn't qualify, we actually got to learn.
If I was permitted, I would have arranged 6 more chairs, ma. That is not a problem. But they had a set round. We can't change that. But good thing was for my last 3 years, first time we had a tiebreaker for screening also. We never anticipated that. 5 questions was planned. If you see 20 questions we had, 5 was for tiebreaker for screening. But this time we never anticipated that we'll cross. Because bad luck andre avaru ibru ononde score madidare 5 marks alli. And that too different questions. You can't take negativity also. If someone had scored differently, then we would have taken somehow. Okay. Sir, over to you, your experiences. You can come on stage, we'll distribute certificates now. Gobru sir, Udra. Ananya, certificates. Why don't you write name first and run up? Write a Tomber certificate, sir. Sir, feedback, obviously.
So the quiz was very well organized. So participants have come from the very far away places, like Ballari. So we are very happy. So our team has won the quiz. At the same time, I noticed sportive spirit of participation in all members. So don't get disheartened. So good luck for the next time. If you are a first year or second year PG. So
sir, please.
It was well organized, sir, first thing. And second thing, I want to tell only one thing. Only studying will not help. Neonatology is all about observation. If you work properly in your own department, then many of the questions you can easily answer. So that is what I can advise you people. And all the best for the BLD, for the next divisional. Divisionals, this one, no? State. So congratulations. Okay.
One second, sir. We are done almost. Note. So I request our respected judges to felicitate or give a token of appreciation for our volunteers first, so that they are not left alone. So I request Dr. Pooja ma'am to come for helping, taking her time out. Guys, both of you. Chappale. Dr. Anvita. Dr. Srinivas. Dr. Soumya madam. Ananya. Karthik. Dr. Mansi. Dr. Aniket. Dr. Vivek. Now certificate of participation, you should have arranged as per teams regularly. We'll announce names. We'll announce the contestant names for all the team. Dr. Likita, JNMC, please come and collect. Sir. Lakan, Dr. Lakan from Gulbarga. Dr. Nidhi next from SDM Dharwad. Arrange as per team now. Dr. Praveen Gowda, SNMC. Dr. Sodhar Nayak, District Hospital, Vijayapura, Bellary, sorry. Dr. Sarvari or Shavani? Sharvari, sorry, from KIMS Hubballi. Dr. Mahima from SDM Dharwad. Alamin team, Dr. Saida and Dr. Darla. We'll call two each now. One by one. No, assemble. Yes. Next team, KBN, Naveshri ma'am and Dr. Sneha. Team Raichur, RIMS Raichur. Raichur team. Team Gadag, Jims Gadag, Dr. Rahul and Dr. Pravan. Next. Hey, Dr. Vims Ballari, Dr. Vidyashri and Dr. Faraz. District Hospital Vijayapura team. Dr. Sita and Dr. Manyati. Ajay. Navodaya Raichur. Navodaya Raichur. MRMC Gulbarga. Inadava. Yes, MRMC. Oh, no problem. Team Bidri, Dr. Bidri's team. Aishwarya and Noman. Yeah, sir. Done? Dr. Gayatri from JNMC. I think their team was left over. Dr. Gayatri from JNMC. Dr. Neelkant from Gulbarga. Next. We'll request Dr. Vijay sir to distribute remaining certificates. Dr. Neelkant from District Hospital Ballari. More than a quarter. District Hospital Ballari. Manaswani. Sorry for pronunciation, ma'am. Dr. Deepa from SNMC Bagalkot. Dr. Sivaranjani from KIMS Hubli. Now I request our judges to give Mogita to Vijay sir, who has been a quiz facilitator for us. Runner up, winner. Okay, now certificates for runner up. Mohammad Faraz and Vidyashri. Sir. Yeah, the appreciation very low. Sir. ಎಷ್ಟು ಬರ್ತಾರೆ ಅವ್ರಿಗೆ ಕ್ವಿಜ್ ಇಸ್ ಓವರ್ ಮಾ ಪೂರ್ವ ಆಸ್ಟ್ರೇಲಿಯಾ ಡಿಪೇಟಿಂಗ್ ಈಗ ಇನ್ನೊಬ್ಬ ಬೇಡಪ್ಪ ಬಿಟ್ರೆ ದೀಪಿಕಾಗೆ ಬಿಡ್ತಾ ಅನ್ನಿಸ್ತದೆ she is also in shock. I wondered. ಇವರಿಬ್ಬರಿಗೆ ನೀವು ಕೊಡ್ರಿ ಜಡ್ಜಸ್ ನನಗೆ ಯಾರು ಬೇಡ ಮನೆ ಹೋಗ್ಬೋದು ನಿಮ್ದದ ನಿಂದ್ರಿ ಸರ್
I request.
Sir, thank you very much. It's a certificate of appreciation for both of you from our side. Yes, thank you. We'll have group photos. I request everyone to come, wake up. We'll give chocolates for standing also. We have to take a group photo. Get up. You 100 or 8 Sir, please. ಇದನ್ನ ಮೇಲೆ ತಗೊಂಡು ಒಂದು ಸೆಟ್ ಚೇರ್ಸ್ ಅದೆಲ್ಲ ಸರ್ ಕೂಡಿ ಸರ್ ಇನ್ನೊಂದು ಚೇರ್ ಒನ್ ಮೋರ್ ಚೇರ್ ಕಣ ಸರ್ ಟೇಕ್ ಕೇರ್ ಸೀಟ್ ಬರ್ರಿ ಬರ್ರಿ ಎಲ್ಲರೂ ಒಂದು ಸ್ವಲ್ಪ ಕೂಡ್ಬೇಕು ನಾವು ನೀವೆಲ್ಲ ತೆಗಿರಪ್ಪ ಬೈದು ಥ್ಯಾಂಕ್ ಯು ಫಾರ್ ಕಮಿಂಗ್ all the volunteers and the winners. Hey, you go. Come. Both of you go. Thank you guys. For your time. Thank you for